Hi, my name is Scott Mazenko, and I'm one of the co-founders of MedicarePlanDiscounts.com. And along with my wife, Lenore, who is pictured here on our homepage on our video, we've been working in the senior benefits market for close to 2 decades with people just like you that are transitioning from the working world into retirement. Now, whether that's coming from an employer background or a self-employed background, there's a lot of questions that come up. And Medicare is an integral part of that. So along with your financial plan, your retirement plan, your Social Security plan, Medicare is an integral part of that. And now more than ever, we get the question is, if I'm 65 years old and I'm still working, how does Medicare fit into the overall picture of my self-employed health plan or my employer plan? And that's when I started doing a little bit of homework. And I really wanted to find an answer to that, and I wanted to find a website that I could refer people to. So as I go over the information in a video, they can easily go check it out for themselves at their leisure. So with that being said, I've got a great article today that came in my inbox, and it comes off of elderlawanswers.com. That website again is elderlawanswers.com. And they have a lot of great topics on there. And the one I wanted to go over with today is how Medicare and employer coverage work. So as you may or may not know, Medicare benefits start at the age of 65. But as I said before, many people are continuing to work past that age, whether it's by choice or by need. So it's really important to understand how kind of Medicare and your employer coverage work together. So really, depending on your circumstances, Medicare is either going to act as the primary or the secondary insurer. If it acts, actually what a primary insurer pays are the medical bills first up to the limits of its coverage. The secondary payer covers the cost. The primary insurer doesn't cover, although it may not cover all the costs. So really knowing whether Medicare is going to be your primary or your secondary to your current coverage is crucial because it determines whether you need to sign up for Medicare Part B when you first become eligible. If Medicare is the primary insurer and you fail to sign up for Medicare Part B, your eventual Medicare Part B premium could start going up by 10% for every 12-month period that you could have been enrolled in Medicare Part B. But it did not take it. So there's a link here on the page for details. You can click here, and that's going to link to Medicare.gov, and that will really break it down for you in the dollars and cents. But what I wanted to go over more importantly is some of the rules governing whether Medicare coverage is going to act as your primary or secondary. And these rules are going to apply to the employer coverage that you may be enrolled in as an employee or under a spouse's plan. So with that being said, one of the conditions is if your employer or your spouse's employer has 20 or more employees. So if your employer or your spouse's employer currently has 20 more or more employees, your employer's insurance will be the primary insurer and Medicare is going to be the secondary. If your employer or your spouse's employer has fewer than 20 employees, Medicare will be the primary insurer and your employer's insurance will be the secondary insurer. So that may be important to say again. If you or your spouse's employer that you're covered under has above 20 employees, the group plan is going to be the primary and Medicare is going to be the secondary. If it has less than 20 employees, Medicare is going to be your primary and your group plan with your spouse or with your previous employer will be secondary. So another condition, if you're retired and still covered by your employer's group health insurance, Medicare pays first and your former employer's plan pays second. Third condition, if you receive Social Security disability insurance and Medicare and your employer has 100 or more employees, your employer's insurance pays first. Some employers are part of what they call a multi-employer plan. And if you don't understand what that is, you can ask your human resources department. They'll be able to go through whether your employer is or is not. So with that multi-employer plan, And if it has at least one employer in that plan that has 20 employees or more, the employer's plan pays first. If your employer has fewer than 100 employees, Medicare will pay first. The fourth condition, if you have end-stage renal disease, which is called ESRD, that's the acronym, and are in your first 30 months enrolled in Medicare coverage of ESRD, your employer's plan pays first. So your first 30 months, your employer's plan pays first. After the first 30 months, if you have ESRD, Medicare becomes your primary insurer, and it does not matter how many employees your employer has. So whether your employer has 20 or less or 20 or more, because of the end-stage renal disease diagnosis that you have, that condition applies. Fifth condition, if you are self-employed and have a group health plan that covers yourself and at least one other person, Medicare will pay first. Note that if you are self-employed, you may be able to deduct Medicare premiums from your income taxes by including the premiums in the self-employed health insurance deduction. So great point for self-employed people is they can deduct their Medicare Part B premiums. Coordinate that with your CPA or your accountant. So they wrap up the article in a quick fashion. They say, if your employer's insurance is the primary insurer, the employer must offer you and your spouse the same coverage that it offers younger employees. So what that means is the employer cannot offer you a different level of coverage, more comprehensive, less comprehensive because of your age. So they cannot discriminate against you based on your age. Also, it cannot deny you coverage, cancel your coverage once you become eligible for Medicare, or charge you more for your premiums, deductibles, and copays. So that's a great little caveat there. Now, I've personally dealt with that in my business. One of the gentlemen I deal with, he's a group health benefits employer, and recently we did a little open enrollment meeting at this employer that he works with because we had some people that were Medicare eligible that were on the group plan. Now, it was less expensive for the employer to have those people come off of that plan, go on Medicare, and get secondary insurance and a prescription plan. So with that being said, we gave people that option when their open enrollment for their insurance came up. Some decided to stay with the group insurance at the same levels and the same costs. Some decided to go with Medicare. And the people that did decide to go with Medicare, in that case, the employer incentivized them and actually picked up the cost of the secondary insurance and the prescription plan, which was fantastic. It gave more comprehensive coverage to the employee over 65 and their spouses, and it also saved the business owner a couple bucks, which is great. So if you'd like some more information on if you're still working, should you enroll in Medicare, great article, same page, elderlawanswers.com. That'll go through that with you. I'm going to be doing a separate video on that. I wanted to do a primary video on really how Medicare and the employer coverage kind of coordinate first. So I hope you guys got some value out of that. I know I've gotten a ton of questions time and time again based on that. Please do feel free to reach out to us. You can go to our website at MedicarePlanDiscounts.com. You can get a free secondary insurance Medicare supplement quote. Also, feel free to call us at 1-844-280-0785. It's in nice big numbers here at the bottom of the page, if I can get to it, right there. 844-280-0785. And also, please feel free to check out our 7-part video series called Medicare, the Inside Scoop, where you'll learn about some of the little-known Medicare mistakes people make early in their retirement that can affect their financial security. You can easily go to that page, check that out. You put your name and your email in, and you'll get a 7-part video series describing all the topics that are pertinent to your retirement and that'll help you from avoiding those little-known Medicare mistakes that can really kind of derail someone's retirement. So feel free to like, share, and comment on this, and I look forward to seeing you on the next video. Have a great day.